Aging isn't about slowing down, it's about stepping into your power. Welcome to Don't Let the Old Lady In, the podcast where we challenge outdated beliefs about getting older and embrace wellness, self-love, and confidence. Your host is Lori Gardner, a registered nurse and nationally board-certified health and wellness coach, and she is your guide on this journey to vibrant, mindful living. Each episode will explore topics that nourish your mind, body, and spirit, and how to navigate health issues in the healthcare system as you age, so you can live with energy, purpose, and joy. Let's get started. Here's your host, Lori Gardner. Do you ever feel overwhelmed by your health insurance? What are the benefits? What's deductible? Do you have a pile of bills, or EOBs, otherwise known as explanation of benefits, sitting in a box somewhere, just not knowing how to address them? Well, ladies, you are not alone. Today I'll be talking about how to navigate your health insurance claims without overpaying. Welcome to the Don't Let the Old Lady In podcast. And I'm going to share 5 essential tips to help you understand your plan, stay in network, and avoid surprise bills, save on prescriptions, and maximize your preventative care benefits. It's time to take control of your health care and your wallet without the confusion and stress. So let's tune into some actionable strategies we can use starting today. And don't forget, I'm going to provide you with a checklist, a free health insurance navigation checklist. So check those show notes. So what is your insurance plan? How much do you know about it? Do you feel comfortable that you have a good handle on the coverage, ladies? Ask yourself, what's my deductible? How about what's my out-of-pocket expense? What services are fully covered before my deductible? And is my doctor considered in-network? These are really basic questions everybody should know about their health plan. Hot tip. Always get a copy of your summary of benefits. That's a simple version of your insurance contract. It's got all the key items in it. Everybody should have one. Electronically, print it out, whatever works for you. If you don't understand it, call member services. You're paying for it. Use them. And document everything you talk to them about with a reference number. If you're still having trouble, that's when people contact us. So we are always available to help you with all your insurance needs. So number 2, stay in network whenever possible. In-network can cost 50 to 80% less than out-of-network. Before you see any doctor, specialist, or get a test, always ask, are you in my network? Very important. Just because the hospital is in network doesn't mean the radiologist or anesthesiologist is. I got a call a month ago from a frantic young couple, had twins. The twins landed in the neonatal ICU, and they got over $200,000 bill from the neonatologist. They thought they checked everything, and they did. Anesthesiologist, the hospital, they were all network, but the neonatologist was not. Tough spot. So find this all out ahead of time. I can't emphasize enough how to be proactive. You can ask directly your insurance company. I highly recommend doing that. I highly recommend keeping track of it, getting a reference number, and optimally a document that proves that they agreed and gave approval or noted that the doctor or the specialist was in network. Sometimes you can check the online portal for your insurance company, and they have a provider directory, and you can check there. In network, you can save, as I said, 50 to 80% less. The out-of-network is not controlled by a health insurance company, so the doctors can charge their highest rate. Whereas in-network, the provider, the doctor, has a contract with the big insurance company. That cuts their rate down because they've got shared payment, and they tend to get more volume. So I did mention in podcast number 6, when I talked about navigating the healthcare system, I talked all about surprise bills. So generally, Surprise Bill Act will protect you from any out-of-network charges if you were not told ahead of time. If you're told ahead of time, I'm not in network, I will be sending you a bill and you agree to that. So always check the fine print, ladies, in whatever you're signing, any document, especially on admission, any kind of financial document, don't just sign it away. You may be responsible for it, but if you have an out-of-network provider that you get billed and they never told you they weren't in-network, you have protection under the Surprise Bill Act. Number 3, know the magic words. Is this medically necessary? Some treatments or tests must be deemed medically necessary for insurance to pay. So before scheduling those expensive tests like MRIs, CAT scans, and surgeries, ask your doctor, will my insurance require pre-authorization? Can you document that this is medically necessary? You can also check with most physicians have insurance departments, and they can help you with this as well. This one conversation can save you from huge surprise bills. So it's important to take a look at, is it medically necessary, and authorizations. Of note, this year in the new big beautiful bill, Medicare is now up in their game. They are looking at getting prior authorizations like they never had before, I think on an additional 17 services, some of which are like nerve stimulators, cortisone injections into the back, maybe exploratory knee arthroscopy. So starting January 2026, Medicare is going to require, and these are generally tests that they have found that have been a source of fraud and overpayments. So that's why they're doing that. But just know you may also have to get pre-authorization. Number 4, understand tiered prescription pricing. Prescription costs can vary based on the tiers. Here's a quick guide to these tiers, ladies. Tier 1 is a generic drug. It's the cheapest. Tier 2 is a preferred brand name drug. That's a little more expensive. Tier 3 is non-preferred brand name, much more expensive. And top tier is Tier 4, specialty drugs, uber expensive. So before filling a prescription, ask, is there a Tier 1 generic option? Most doctors know if there's an alternative. But get the advice of your doctor as well as checking in with your pharmacist as a double check, because they can often recommend alternatives your doctor can approve. Number 5, maximize preventative services. Most insurance plans offer preventative services covered at 100%. This includes things like annual physicals, mammograms, colonoscopies, and vaccinations. Get them. You're paying for them, whether you use them or not. But be careful. We've had numerous clients call us if they have one of these quote-unquote 100% preventative service covered procedures, and they get charges. You can as well, but we do push back and we do some investigation with the healthcare provider's office. We look at the coding. Sometimes it's the coding that's wrong. So all of this has to be adjusted so that it is 100% covered. I do a good amount of community talks, and one is on just insurance, being an empowered healthcare consumer. And one of the first things I see, the eyes in the audience kind of wide open when I say, don't ever pay the first bill. Because it takes a couple of billing cycles for the provider, the doctor's office, to move the codes through, and it takes a while to get through the insurance company to get it right. Unfortunately, people don't always know this, and you could get a bill for a whole lot more than it's going to end up being once all this, I call it crazy stuff, once all these cycles go through. I don't know any other industry that you get bills and the number changes over time. So just be aware of that. It's important. I always do recommend, though, don't ignore anything. If you're in a bind and you can't pay the bill, or you want to make sure you have the correct number, you always have to go back to your insurance explanation of benefits. That number should absolutely match the number on the provider's bill. So really important to have these checked. I will be talking about in the next few episodes, I'll be talking about how to navigate your medical claims and do an appeal and manage your costs, as well as the ABCs of Medicare. So as a wrap, a quick recap. Number 1, understand your plan. Number 2, stay in network. Number 3, confirm everything is medically necessary and it's documented. 4, be smart about your prescriptions. 5, use your preventative benefits. So as I said, sneak peek for next time, I'm going to dive into how to negotiate a medical bill and when. You don't want to miss this, ladies. And a quick fact, 80% of hospital bills have errors on them. So can you imagine? A lot of people can be overpaying. So I look forward to providing that for you next time. If this episode helped you, share it with a friend who could save money too. And don't forget to follow me, drop me some comments, any questions, and I will see you next time. Ladies, until then, don't let the old lady in. And that's a wrap on today's episode of Don't Let the Old Lady In. Remember, age is just a number. Your mindset, energy, and passion are what truly define you. If this episode spoke to you, don't keep it to yourself. Share it with a friend. Subscribe and leave a review so we can continue this journey together. You are strong, vibrant, and unstoppable. Until next time, keep living boldly, loving yourself fully, and most importantly, don't let the old lady in.